Is it good now?
It's little echo in your voice.
I'll just share the screen. Can you just check if it's coming?
Yep. respected members and all the registered delegates for this webinar on role of public health dentists in India. On the eve of Public Health Dentistry Day, a week-long celebrations and different activities has been organized by the head office and respective institutes across the country. And this is the first time we are organizing a webinar at a national level, and there are many international delegates also registered. And there's an overwhelming response for this particular webinar. More than 700 people are registered, and in live stream there are more than 500 people are live watching this particular webinar. And I once again wish all the members of our specialty a very happy Public Health Dentistry Day. And for this particular session, there was one more event before this webinar, that was the launch of our competencies for public health dentists in India. Unfortunately, due to unavailability and tight schedule of the chief guest today, we are unable to do that. So we have rescheduled this event to the upcoming national conference that is going to be held in Goa during the inaugural function of the national conference. This event is rescheduled there, and it will be the competencies for public health dentists in India will be released on that particular platform. I once again thank you all for joining this webinar. Now I request our President, Sir, Dr. Sabyasachi Saha, Sir, to deliver the presidential address. Thank you. Over to you, sir.
Am I audible?
Yes, sir.
Good morning, one and all. On this great occasion of National Public Health Dentistry Day, first of all, I acknowledge the enormous contribution of late Dr. Mohandas Bhatt sir, Padma Shri Dr. R.K. Bali sir, our beloved President Emeritus, all the former President, Secretary, editors, office bearers, founder members, obviously, who has contributed a lot to go through all the good times and bad times, and because all of their hard work and dedication and contribution, whatever we have achieved and whatever we are here today. Side by side, now we are almost having a life member and student member strength of 3,000. So I acknowledge from my bottom of my heart that every foot soldier of public health dentistry who has enormously contributed through their organization, through their department, through their other, wherever they are they are attached or affiliated, their wholehearted participation for the upliftment of this subject. Side by side, I will fall short in my duties if I don't acknowledge the continuous support, especially during Dr. R.K. Bali's time, and followed by from 2011 onwards from support we are getting from Dental Council of India. I acknowledge wholeheartedly President DCI, Dr. Dibyendu Majumdar, who is our honorary member also, Vice President Dr. Satish Reddy, and especially in the time of 2012-13, I still remember when we are fighting against all odds to give our specialty, our department, a standalone concept. And that time, the enormous support we got from Dental Council of India, we should acknowledge that. Until date, it is the same way it is going on. I should acknowledge the different state chapters who are working very hard for as a flag bearer for our specialty, especially recently, 2-3 days back only, Tamil Nadu chapter has introduced newsletter in local vernacular to go to the masses, to the community. It's a definitely encouraging step for others also to follow. Now, in this special occasion, few of the things which shortly we can it will be reached to all the people of public health dentistry in India. Just to give you a few glimpses, that just on the we should all enjoy and rejoice just on the eve of this Public Health Dentistry Day on 13th of June. Government of India has formed a national steering committee to promote the oral health, and I am happy to share with you, out of 18 experts, 8 are from public health dentistry. That speaks enormous volume. It speaks about our subject and presently where we are standing. at the national level. Now, in the new BDS curriculum, we have already shared with many of you that we have introduced professor for public health dentistry in all the colleges, undergraduate colleges also. We are introducing senior residency program in public health dentistry, like other subjects also in the new BDS curriculum, which is awaiting for the gazette notification from the Government of India. We are planning through Government of India also to upgrade the tremendous activity all of you are supporting, that is tobacco cessation centers. We are presently working with the Government of India to upgrade it as a wellness clinic kind of concept, where it will be like a TCC, tobacco cessation will be there. Certainly the awareness and counseling for substance abuse, as well as we can focus on the non-communicable disease also. So it will be like a lifestyle counseling center overall, to give our postgraduate students and faculty more exposure to how to national health programs works. And most importantly, I'm very happy to share with in the new curriculum which is proposed to the Government of India, as per our general body decision, we have renamed the nomenclature of the subject as public health and preventive dentistry. So the now onwards, if it is notified in due course of time, our subject new nomenclature will be public health and preventive dentistry. I think that will give a wide exposure, and almost all competencies will be covered, which is due or which is expected for a public health dentist. Now, on this occasion, I will not take much of time, because we are all here to listen from Dr. Iaphd sir. And on this occasion, once again, I request and I wish to arouse among the faculties as well as among the postgraduate students the hard work, dedication, and integrity for the subject and the speciality, as well as the work ethics, so that we can take out our subject to a newer heights. Thank you so much once again, and long live IAPHD. And it is again over back to Secretary sir.
Thank you very much, President sir, for your inspiring and motivational words. And you are the man who always encouraged the youngsters in the association and taught us how to take the association forward with the blessings of all the founder members and the elders of the association. Now I introduce the speaker for the day, Dr. Ashwath Narayanan sir, who doesn't need much introduction. All the members who are attending this particular webinar are very, very well aware of what sir is, and we all are, all the public health dentists in India and across the globe are proud of Dr. Ashwath Narayan sir for his achievements and his continuous support and taking this speciality and the association forward. Currently, Dr. Ashwath Narayan sir is working as a registrar, Tamil Nadu MGR Health University. He is also a member of Niti Aayog Expert Group for Dental Surgery Practice Guidelines, and he was part of NABH member Expert Group for Framing Dental Clinical Guidelines, and worked as a State Nodal Officer NOHP Tamil Nadu, and as a part of DCI Syllabus Committee member for the Specialty of Public Health Dentistry, and he was a part of National Oral Health Policy of Health and Family Welfare Government of India, NAC Assessor, NBA Assessor, and a member Expert Group of FDI, and WHO member Expert Group, and he is our founder member, and he is ex-president and ex-secretary of our association, and still there is a list, a long list, and I don't want to take much time. I request Ashwath Narayan sir for please proceed with the webinar, and we thank you for accepting our invitation, sir. Over to you, sir. Thank you very much.
Good morning, everybody. Thank you, Vamsi, for your kind words. Respected President of Indian Association of Public Health Dentistry, Dr. Sabyasachi Saha, the Honorary General Secretary, Dr. Vamsi Krishna Reddy, our President Emeritus, Dr. R.K. Bali, members of the Executive Committee. A special thanks to the President of the Dental Council of India, who is an honorary member of the association, and all the delegates here today. It gives me immense pleasure. I'm very proud whenever I speak on this platform. And this is the only platform in which I'm usually very scared to talk to, because everybody is very knowledgeable about the subject. They don't need something to be repeated to them. And at the same time, a good crowd to talk to and share ideas with, which we can discuss later whenever we meet in person always. So it's my proud privilege. This topic is a little tricky topic, in the sense what is the role of public health dentistry in India today at this point of time. I would like to start by informing all the people who are listening here, the youngsters. My colleagues are already aware of what I'm going to speak now. We need to understand the history of the growth of our association and oral health as such if we need to be good public health dentists. The remaining 8 subjects earlier and presently, if forensic odontology adds to that, the remaining 9 primarily deal with individual clinical subjects for which local knowledge is sufficient. Which when I mean local knowledge, I mean the knowledge referred to in the textbooks of the particular specialty are sufficient. Whereas public health dentistry, you need to be a know-all of everything in every sphere of our country to be a good public health dentist. It is not just book knowledge alone. It is how much you gain over years, how much your eyes and ears are open, and you have to understand where we came from to know where we have to go forward. I would like to take a first few slides towards those lines to underline what we should also be doing. I'll share my slides now. Those are the 3 wonderful logos which have been created by the head office for this year's usage. What is our current role? Everyone who has joined this subject has joined with some dream in their mind. The first one being to get some MDS degree, which is the part of everybody's thought process. And the second one is a passion. What does this subject offer that I can do very well and be very contented at the end of the day and at the end of my life that I have achieved something in that specialty? These 2 people here denote what can be achieved by public health dentistry in India. One person who started his BDS long before and then went on to outside India, came back to India, built the system, started the public health dentistry program at the council, and is now our president emeritus, been the longest serving member of the Dental Council of India. The other person who is currently the president of the Dental Council of India, who has singularly taken our subject from being one of the other subjects to the forefronts today. And he's a very strong believer that public health dentists must deliver very well if dentistry has to grow. Our pranams to both of them for promoting our specialty in our country. Now, this is a subject which is something which you teach everybody when you start. Public health dentistry is that part of dentistry providing leadership and expertise in population-based dentistry and health surveillance, policy development, community-based disease prevention, and health promotion. Do we really do this on completion of the program? It is a unique among the specialties whose practitioners focus on dental and oral health issues in communities and populations rather than individual patients. Do we really do this again? Have we lost focus somewhere in between in trying to do other things also? It is defined as the art and science of preventing and controlling disease, prolonging oral health, and promoting oral health and prolonging the life of oral tissues through organized community efforts. Are we doing that again? So these 3 definitions, which forms the bulwark of our specialty, are we really doing this activity? Is something which we need to slightly ponder about. We had various goals as we progressed. I don't deny any step was not required. We needed all those steps at every point of time. Every single act done by the Public Health Dentistry Association and all the senior members here at every point of time had its own need to be where we are today. But where should we grow from here? Let's see how we started. 1965, that is almost 57 years ago, the initiation of the WHO 208 program for the development of modern dental curriculum or syllabus in India, which included preventive and social dentistry. I was born in 65. This idea was shown in 65. It was conceived at the WHO dental health unit by Dr. Mario Chavez, and one fledgling school had to be selected to develop as a role model for all of Asia. I'm going through this to also enable all the youngsters to know, what rich traditions we come from. And Colonel N.N. Berry, who was then the Honorary Dental Advisor to the Government of India and the President of the Dental Council, chose Government Dental College, Bangalore. Ironically, he proposed starting a diploma course in public health dentistry in the third year, 5-year plan in 1961 to 66, amongst the other things at the All India Institute of Hygiene and Public Health in Calcutta, if funding was provided. Somehow this never happened. I think probably we are having a president from Calcutta now who is helping us probably because of those old roots. I was surprised when I went through this literature that we have a president from the same place who is helping us now. In 1966, Chavez visited India and visited GDC and proposed that plan to the CRO committee, where Dr. Alberto Arango was visiting Delhi at that point of time from Geneva. And so many things happened simultaneously so well that in 66, Dr. S. Ramachandra, the founder of Government Dental College, Bangalore, took upon the burden of implementing this program. In 68, the Department of Public Health and Social and Preventive Dentistry was set up by Dr. Mohandas Bhatt. He was an orthodontist. Imagine there were 2 orthodontists in GDC, and the government felt there were too many, and one was made into a public health dentist. Dr. Mohandas Bhatt went on to go to the United States, study in Pittsburgh, then later in Michigan, to come back to India after a worldwide tour to start our specialty in public health dentistry in Government Dental College. He was our faculty, and imagine the strain that he must have undertaken to get people from Bangalore Medical College, St. John's Medical College, NIMHANS, and the Directorate of Health Services to teach the medical subjects required for our specialty people. At that point of time in 68, I would just like all of us to ponder if we are providing that sort of a wide atmosphere of learning to all our postgraduates today. This is for an undergraduate program. And in 1970, he started the first MDS course in community dentistry with 5 students. In 72, the first 2 MDS students in community dentistry graduated. Dr. Shankar Aradia was one of them. He was asked to head the department. The other professor left to the United States. And then in 1983, the Dental Council made community dentistry compulsory in the syllabus. And in the 1986 batch became the first batch to take the examinations separately in public health dentistry. I belong to that batch. 1986 to 96, 2006, 2016. We have traveled a long way from that time. The goals of starting this specialty from 1965 to 1986 was to improve the oral health status of the whole country. It was not just to be in the classrooms. So many visiting professors came from abroad. Dr. Pinberg, Dr. Arango, Dr. Arthur Held, and Dr. Bernard from Sydney came later as visiting faculty to share their knowledge on how public health dentistry was going around all over the world. Such was the zeal and enthusiasm. When I passed public health dentistry in 1992, I was the 24th personnel in the whole country. You can imagine. We are 2,000 today. So what sort of resources, what sort of learning experience, what sort of professional backing, the council's backing, people should have had at that point of time, and still worked hard to make sure that this subject is going in the right direction. The person you see on the right is Dr. Mohandas Bhatt. The next to him is Dr. Shankar Aradia. I just happened to meet, we happened to meet in the conference earlier. These are the photographs of us at earlier times. The Dental Council of India has now has framed the syllabus with these 4 in mind for a public health dentist. The knowledge and understanding. The student should demonstrate adequate knowledge and understanding of the influence of social determinants and oral health. Available tools for measuring associated factors and different aspects of addressing, including healthcare delivery system. The applications should demonstrate the application of the above knowledge in selecting relevant tools, interpreting the data, suggesting interventions relevant to the context at individual and community level. And the procedural skills to acceptable levels of competency. All of us should have a very high skill set. And lastly, the attitudinal and communication skills, including professionalism. The student should demonstrate a compassionate attitude towards patient and effective communication skill, ethical behavior, and professionalism. This is for public health dentistry. Such wonderfully thought out 4 statements, if you keep reading them again and again, is so pregnant with meaning. They're what the council expects of us, what the council expects a public health dentist to do today. Do we really stick to what this is? Oral health is integral to general health. You cannot be healthy without oral health. We don't deny. The goal of oral health, of improving oral health, must be an integral component of the mission of any healthcare system. Is that happening now? Have we really tried hard enough? We have reasonably well. Dr. Saha just now informed that the draft group for the National Oral Health Policy constitutes 8 public health dentists now. A commendable achievement, realizing that there are nobody, as I go through the further slides, you will know earlier. Goal of the dental profession is to maximize oral health of all individuals. That is what we should have in mind. It's not treating some few people who come to our clinic or our institutions alone. That is part of the program. That is part of the remaining 9 specialties program. The whole goal of public health dentistry is to make sure to maximize the oral health of all the individuals. And the achievement of this goal will require the combined efforts of the dental education, research, practice, industry, the government and public. It was to canvas the remaining groups into channelizing their efforts into providing maximized oral health to all the individuals is what must be the primary goal of a public health dentist. That is for the same reason we have joined this specialty. This is what we must keep in mind. Have we contributed to the oral health policy of this country earlier? Just let me lead you through that part. I just showed you what public health and how public health dentistry grew in India. What were the goals to where it was. Now let us go back to the general health. We all have read in our third year textbooks and final year textbooks, Park and Park, the various committees which were formed from 46 till the health mission was there. Oral health diseases contributing of these 7 specific diseases which we are responsible for. The public should not suffer from any of these 7 diseases. 1938, you can imagine, I'm leading you through the history to tell you what we should do. 1938, there was a newsletter by Dr. K.L. Shourie about the need of a comprehensive oral health program. Vision, you can imagine, in 1938. In 1939, we had the Bengal Dentists Act. Once again, there is some connection between Bengal and public health. Establishment of the All India Dentists Association in 1945. 1963, the Indian Dental Association Memorandum to the Government of India. See, this is all way back. When 63, most of us in this room did not think about dentistry either. In 73, in the IDA conference session, we decided that we need to form a national oral health policy. Alma Ata Declaration gave the necessary thrust. IDA started the discussions on implementation of the Alma Ata with 6 committee members. In 80s, steps were taken to the formulation of a oral health policy, ET. Which means 20 years, another 20, 40 years before steps were undertaken by visionaries. Now see this, in 84, the first workshop on oral health policy was done. This is the whole book by the Indian Dental Association. The 6 names that you see on the right side were the people who were deputed to do this work. And finally, 2019, after Dr. Swasti Charan took over, the regular passage for the National Oral Health Policy took shape. These were the 3 earlier meetings conducted to finalize the oral health policy. Now, why am I coming to all this? Our whole specialty was designed only to do these 2 activities that I'm talking about. We have also grown on the other side. Dr. Saha now mentioned this morning that our specialty is to be named public health and preventive dentistry. Public health, if we are not very strong in public health, and if we limit ourselves only to preventive dentistry, then the true goal of a public health dental surgeon will not be realized. So I beseech all of you who are now joining this program to keep your mind fine and open to the opportunities that I'm going to tell you now. These slides I have taken from the National Oral Health Policy guidelines. Okay, to tell you what are all the activities that the public health dentist should be doing today. The burden of oral disease. Do we know the burden of oral disease? This burden is the duty of a public health dental surgeon. Others will not do this. We need to conduct good surveys in whichever place we are. You don't need to specifically become a member of the National Oral Health Survey Program to do a survey. Everyone has their own practice in various areas. Everyone is a member of some association. Every one of us is a postgraduate or a faculty. In whatever limited faculty, that a limited facility that we are in, we have to conduct a disease burden survey in whichever place we are, and record it appropriately and immediately send it to the head office to form part of a global data bank. A global data bank can come only from an Indian data bank. So every one of us must continuously add to this literature. This is our first goal. Whenever we talk to any policy maker, the first thing they ask us is, how many of you people are affected by those 7 diseases? What is the loss of working hours, the morbidity and the mortality, to enable me to give you funds to do, or enable me to start programs for you. This is our duty. No other specialty will do this. So this is number one. In whichever status you are, even in your clinic, at every month's time, just see the number of patients that you are seeing, the number of people who come with the various dental diseases that I have enumerated, and what is the treatment plan that you have done for them. That can be sent to the head office in a consolidated format. Nobody is going to give it to the IT department to come to your practice. That is data. It's individual data at the lowest level, wherever you are working in. The second part, social determinants of oral health. In whichever place you are in, I would not want to repeat it again. Wherever you are, the socio-economic and environmental factors that affect oral health. We have studied separate chapters. We have the 5 pillars of public health that we have studied very well. They should be put to use. Whenever an individual sits in your chair, the first thing that you must come to your mind is, what a socio-economic and environmental factor brought him to my chair today? That question must be answered by you, by the teacher, by the student, by every single individual, why he came to my chair. That determinant must be the cause for you promoting some particular oral health activity in whichever area you are. The third is the common risk factor. We have to take a good history on tobacco use, the physical inactivity, the unhealthy diet, and the harmful effect of substance. And lastly, stress. On every case sheet, these 5 should find a mention as a separate mark, so that we know if these and oral diseases are related. There are studies elsewhere, and there are people who keep talking about this. But as a public health dentist, my interest would be to find out if these have any important activity related to oral health. Human resources. What are all the human resources that are available in my area? If anything new that you find, somebody doing a wonderful job who is directly not related to dentistry, but very important for the oral healthcare delivery, that should immediately be brought to the notice of the association and the council. If any activity can be included to this oral health resource, please mention it immediately, so that this can be made into a mainstream effort. Our country is a huge country. It constitutes almost 1/7 of the world space, 1/5 of the population, which we know 35 times whatever we are doing will be relevant to the whole world. So the human resources which help us, not necessarily only the 10 specialties, the dental hygienists, the dental technicians, or the DORA people. Anybody who is contributing, all those contributions must be included into the dental education infrastructure to enable disparities between the various areas to be overcome. Then, coming to the oral healthcare delivery system, we have now contributed a wonderful knowledge to the IPHC standards. IPHC standards have now been enlarged to include public health dentistry at various levels, and the dental care delivery at various levels. A wonderful document is in place. Once it is out in the public forum, all of you will know how much it can improve the data. Now, the work of a dental surgeon sitting there is to provide oral health care delivery. The work of the public health dentist who is in that particular area will be to find out the limitations of the existing IPHS. If people think that job opportunities for public health dentistry is this lecture, no. This is about what is the role of a public health dentist today. Now, these are all the roles which are open to you. You just have to take it to the concerned authorities to make sure that your role is automatically known. So, oral healthcare delivery system, something is going on in your area. You go and see what is happening. You just need to go and speak to the local councillor or the local MLA or the local MP, your local health minister, your local government, and put forth the ideas, whatever you have. That is the work of a public health dentist. Financing of oral health services. Now the economic burden is so high, oral health diseases, that it is not possible to provide curative care at all to everybody. It will be a total failure. I see people going and talking to the government about providing, orthodontic treatment, crowns and bridges, implants when they talk to the government. Believe me, gentlemen, that it will never work. It's totally in the wrong direction. The amount of money that is available for healthcare is very, very small compared to other important sectors. So mortality is what will rule the thought process of any administrator, and all our advices to anybody should be based only on preventive care, or at best interceptive care, which is costing so less and can be so cost efficient that it produces fantastic efforts. It is the duty of a public health dentist to appraise this to the administrator. Financing cannot happen for curative care. Financing can happen only for preventive care, because however much a dental surgeon tries, it is very difficult for us to kill somebody. Unless he dies of his own because of substance abuse, mortality cannot happen. So please, whenever all of you talk to administrators, a public health dentist must talk about preventive care only. Don't get carried away by jargons like lasers, implants, crowns and bridges, and orthodontic braces, Invisalign. When you talk to a government man, when you're implementing any scheme, it's a no. We have not reached that stage yet for our population. Values and principles. It is up to us to inculcate this to all the remaining 9 specialties. We must talk to them. The Dental Council has designed a program where the public health dentists will now talk to all the dental surgeons when they are in the first year in their foundation course. Now, this is the value and principle that we must teach them. Professionalism, integrity and ethics, universality and equity, affordable, patient-centric, accessible quality care, inclusive partnerships, dynamism and adaptiveness. Now, these 5 terms I have taken from the course of things to tell you what we should talk to them when we are talking to them in the first year. What our subject actually means should be carried to them. And the vision must be the oral health care policy document which we are going to bring about. Now, the objectives and targets that public health dentists should look after is specific quantitative targets for oral health status, health system performance, oral health system strengthening, and oral health management information. Now, these activities others will not do, sir. See, they have their respective tasks cut out. Many a times people keep asking in our conferences and other areas, sir, what are our tasks which we can go and tell other people? This is exclusive to public health dentist. Whatever I have told today is our job. This will not be done by others because they have not been taught these things at the UG or at the PG level. We have been taught. If we are not teaching this well, we must raise to teach this well. Knowledge will not descend on mankind. Mankind must raise itself to knowledge. It is the duty of every single teacher, faculty in public health dentistry to make sure that these things are taught, and that should be our close to our heart. If somebody else is doing this work instead of us in an institution, it means we are not doing enough. We are not taking what is duly right to our specialty. So what should our priorities be when we speak about national oral health care delivery? We should ensure adequate investment, a comprehensive oral health care, focusing on prevention and promotion, assured services of asepsis, affordable oral hygiene aids and immediate pain relief, accessible, affordable oral health care, strengthening the infrastructure in the 3-tier healthcare delivery system, and using of digital technology for improved access. Somebody just need not necessarily start this from the top. It always has to start from the top to enable uniformity, to give guidelines, to enable easily followable practices, to make it cost effective. But each one in our own small way can contribute wherever we are. Quality of life for every individual on all age groups and special emphasis on vulnerable populations is our care again. Others will not do that. They will say, sir, it was very difficult. That child is not at all cooperative. I do not know what to do. That child would be our patient. What we will do to make sure similar children all over our locality get proper treatment. Now, integration with other national health programs. Others are not aware. There are so many national health programs which can be integrated with ours. So many non-health ministries which can be used by us. So many educational institutions which are waiting to help us. We are so focused only on our specialty and our activity. I want to study PhD. On completion, I want to become a lecturer, I become a reader, then become a professor and head, then start post-graduation, and then continue this activity. And once all the courses and all the departments dry up, I think my work is over. Now I have nothing else to do. No. There are so many other non-health ministries which are waiting to absorb the skills that we should have got when we studied, which was what I was talking about earlier. There are so many other educational institutions which are not health related, which need our services. So many industries who have CSR responsibilities, who need some dental surgeon to do the work for them. And if it is a public health dentist, that assume you have a big industry with 6,000 people. One small example I'm giving you, and they want to employ a dentist. And if they employ a public health dentist, the first thing this man will go and do there is to ask all of them to come together to give a health education program. And once he educates all the 6,000 people, imagine 6,000 families going around to get dentistry treatment from 6,000 dentists everywhere, wherever they are. The job opportunity was provided by this single man with a wonderful knowledge who went and disseminated oral healthcare delivery to 6,000 people on one single factory wherever he was located close to his house. That is the duty of a public health dentist. He will also be a dental surgeon who will practice preventive dentistry in his own practice when those 6,000 people come to his clinic, whoever is staying close to him, impressed by what he has told them to maintain their good oral health care. That is your duty. That is where we should go and enable ourselves as public health dentists. We are dental surgeons first, BDS. We are masters of dental surgery second. These two skills have been taught to us to improve our own specialty skills, and we are public health dentists thirdly. So any opportunity open to a BDS graduate is open to us. Nothing is beneath our realm. Wherever we have our eyes open and snatch that opportunity and go inside, then we can put forth the views of a public health dentist and do what is passionate to our heart. And that is where community involvement comes. We engage civil society, we engage community leaders, we engage PRIs to do our job very well. Partnership, strategic partnership, and the common risk factor approach. Whenever we are part of a healthcare team in any small activity, you may be having a group practice where your dental surgeon is practicing with a cardiologist, with a pulmonologist, with a rheumatic surgeon, with a gastroenterologist. The common risk factor approach to all our practices in that particular clinic itself can make our public health activity go very well. Call all the people working in that hospital to, for a single day. Give them a oral health lecture on all the dental diseases and how you can prevent them. Just see how much your respect goes overnight. You don't have to do one extraction to do that. Just tell them you need 15 minutes of your time. You have been educated for this whole activity for 3 years. Just call them to a common room and talk to them and see how much they are more impressed with you the next morning. People who never knew they had dental problems will come and sit in your chair. And IEC and BCC, wherever you are, there are very good IEC brochures available given by the Ministry of Health. Just stick them. Taking a photocopy and sticking them. No need to use even our gray cells to create something new, already existing. If you educate the people wherever you are, automatically they become, your lifelong committee members. Patient-centered quality of care, which should be patient-friendly, need-based, replicable, and then advocacy. This is what I was talking about. This is what we are trained for. Mobilizing support from political and community leaders and the industry. Others are not trained in that. Which is why I tell you, there are various subjects which have been included in our specialty. Ethics, behavioral science, hospital management, cessation of all activities. I can go on enumerating here, which if we don't teach very well, which are our strengths, Others will start teaching them and making them into separate modules and teaching them separately and growing without us realizing that primarily it was our fault. We should have taught all this to our students. We should have called all the faculty in our institution and informed them about this. So the advocacy is our strength, sir. We should never lose that opportunity. And lastly, the availability of affordable drugs, oral hygiene aids, and dental equipments, we should make that. If somebody comes and tells you, sir, we cannot provide enough dental chairs for everybody, it's very expensive. As a public health dentist, we should start thinking, how can I provide affordable dental chair to everybody? That's our job. That's not the job of an orthodontist or a prosthodontist. Sir, this material cost is very expensive. I don't have an alternative. It is our job to find out how we can make those materials available cheap to the individuals. Development of those materials is somebody else's job. How to make it equally easily available, that is our job. If you can imagine, 15 points in this and 14 points earlier are all our duties as a public health dentist, sir. So much of work is there. We cannot fulfill all that in our single lifetime. That much to deal. So what can we do? We have to plan oral health program for our populations. We have to select strategies and interventions for the prevention and control of oral diseases and promotion of oral health specific to wherever we are. We have to develop resources, implement and manage oral health programs for the population. We have to incorporate ethical standards in oral health. Wherever you see something which is going on, that ethical standard, we have to go and inform. We have to evaluate and monitor dental care delivery system. Or something is going on in our locality, in our state, we can evaluate it in a nice professional manner and go and talk to the health personal administrator and give it him and come. You have to repeatedly go, sir. Nothing is handed into a platter. It is a very, very hard work to get recognized. But when they see your sincerity, it is always recognized. So a lot of hard work. See, it is not our job to sit in an office and do work, sir. We have to go around various offices. We have to go around meeting various people. We have to put forth. We have to sell public health to the people so that they, listen to us. And once they are convinced that you have the best interest of the population at large, then nobody can stop you. If you see in any institution, if there is somebody whom the principal is always afraid of, it will be the faculty of public health dentistry people only, because they seem to get all the attention everywhere. They are liked by everybody. They are the chief guests of all meetings. Which gave you that opportunity? That is what you should teach. I mean, it's not sitting in the chair as a chief guest, which is important. The opportunities which were presented, which you utilized well, made you sit in that chair. It is the duty of every one of us to tell that to our students. We must communicate and collaborate with groups and individuals on oral health issues. We must design and understand the use of surveillance systems. We must advocate, implement and evaluate public health policy, legislation and regulations to protect and promote the public's oral health. The oral health of every individual of this country is more important than our post and position. We must have that in mind. And every individual comes to you, it is your duty to make sure that every citizen of this country has adequate oral health, both in terms of prevention, intervention, and cure. It is not the duty of the other 9 specialties. It is our job. Critique and synthesize scientific literature for proper use, design and conduct population-based studies to answer oral health and public health questions. Keep on finding new questions. You don't have to, ape anything from anywhere. The most intelligent race in the world, I would say I belong to that race. We have to create the questions and answers. We have 2 the future of public health dentistry in our country. 2 dynamic people who have risen from being an ordinary postgraduate student, coming and talking to all the conferences to be where they are today. Extraordinarily influential. Very proud of them. If it was possible for them, it is possible for every one of us in this room. It means we have not tried enough. That's how I would put it further across. My take-home message from all of you is to keep the opportunity-seeking cells in your brain active at all times. The minute you get into the PG postgraduate program, you think all your achievement is done. I am a postgraduate. No, that is the step which is beneath your feet. Then you become a staff member. Then you become the head of the department. That is when you first come to the shock level of your body. Then you have your knees, then you have your hip, you have your heart and the brain. It is all, a long way off. It is one long, wonderful, enjoyable journey with a lot of roses and wonderful thorns. Those roses keep goading you to do better. Those thorns make sure you don't make the same mistakes again. You have to seek opportunities to do good to others and to yourself at the same time. Every single act of growing will include some amount of self-interest, must be there. But that self-interest must be based on some common good. Then you will grow with everybody. When you see a golden opportunity, seize it and exploit it. Carpe diem, today is our day. You cannot wait for tomorrow morning and say, sir, I was not prepared at that point of time. I had to do this, I had to do that. Everybody has that. You have to choose the day as it comes. Grasp the opportunity. It may come in any form. It may come in the development of a new concept, a product, or a technique that is innovative, cheaper, or best. You will know it when you see it, provided your opportunity-seeking cells are active. Keep your mind open. I want to grow. I want to do. I came to study this subject with a totally different mind. I need to find newer ways of making the people of my country oral disease free with wonderful oral health. Keep on looking for those opportunities. When you don't look, you don't see. I would like to conclude by saying the ultimate aim of the medical profession must be to eliminate the need for its own existence. When all of us have worked well, there will be no work for curative dentists. That day will never happen, believe me, so don't be afraid. But our goal must be towards that. And greatness is not in doing extraordinary things, it is in doing ordinary things extraordinarily well. Every single activity that you must be planned and done very, very well, however small it is. You may go to a classroom, you may go to a lecture and find only 2 people sitting. Those 2 people came to listen to you. It is your duty to give them 100%. That's what they came to hear. And lastly, nothing can happen without honesty. It's always the best policy. Wrinkle and gray, both are inevitable, but truth loss is not. Jai Hind. Thank you for this opportunity.
Thank you so much, sir, for taking us to the journey of public health dentistry, the association, and especially the roles of public health dentists and how to talk to administrators and about advocacy and taking it forward. The house is open for discussion. Any of you have questions, can you put it in the chat box or raise your hand, please? Amit?
Yes, sir.
Yeah, if anyone raises hand, promote them and
Yes.
for any questions. So, dear participants, if you have any questions, you can put in chat box or you can raise your hand, please. I see a lot of thank you messages from all of the participants. I'm still waiting for any questions from them.
Dr. Vamsi, there's one question in the chat box, the Q&A section.
Vikrant, I'm unable to see it. Can you take it? Can you take the question, please? Dr. Chandrasekhar Janikram has raised a hand. Amit?
Yes, yes, sir.
So there's one question by Dr. Sai Kumar, and the question is, what are the chances of an epidemiologist in India?
Can you go ahead?
So what are the chances of an epidemiologist in India? As a public health dentist, how can you contribute as an epidemiologist in India?
Every single medical college, let me start that way first. Every single medical college has a preventive and social medicine department. And the preventive and social medicine department has an epidemiologist whom they either directly deal with or use people from outside to get their epidemiological work done. Every single medical institution have a lot of funding programs in the basic sciences category. for which they look for epidemiologists. And I was surprised because I did not know this earlier until I came to the university. We have a department of epidemiology here, and this epidemiologist man, he goes around and he doesn't have enough people to do all the work. There are various schemes in the government of India which keep asking for epidemiologists. I think, and most of them come on the websites. So the first one opportunity will be the local medical colleges, which are all available close to their place. The second one will be all the various departments which need epidemiological work to be done. We always think epidemiology means we're going to do oral health screening and camps and that sort of. No, this is totally different. So apart from the health department, the other departments also ask for epidemiological epidemiologists. And a lot of opportunities are open abroad. I'm not very competent to speak on that because I do not know much, but I did have one seminar. I did attend one seminar earlier where I just did get to understand that there are a lot of opportunities outside India too, which you can work from here. When they would like to need data from our country for their various activities, these epidemiologists are put into use.
Okay, so we have another question. So Dr. Madiraju, Sirisha Madiraju has asked, what are the best sources of funding for oral health programs?
There was one good lecture by VP Mathur. He had given one good lecture in one of our association meetings on the various methods of funding. That's a separate lecture by itself. I have a PPT on that. Probably I'll share it with the head office. You can put it on the website and send it to this individual also. There are a lot of sites available all over the government of India, sir. It's not just ICMR. We all think that only ICMR funds and every other source is not there. That's not my personal idea too. It was Dr. Mathur's good PPT. It will take a lot of time if I put it here now. So I will just pass it across. You please pass it across to him, Dr. Mohanty.
Yes, sir. Yes, sir. So the next question is by Dr. Chaitra. She asked that how can we plan for a national oral health survey through our association?
What is Dr. Chaitra doing anyway? To just brief her, there was one national oral health survey held in 2004, sir. A wonderfully done, perfect survey, if you would call me in the methodology perfectly. In the implementation part, I would give it 9 out of 10. And it still happens to be the best data we have all over the country. Which was started by the Indian Association of Public Health Dentistry along with the Dental Council of India and the Indian Dental Association. Another survey is now in planning in process under Dr. Sabyasachi Saha's guidance. I think it should be out any time, shortly, maybe with the help of the Ministry of Health and Family Welfare. It is on the way to get the data as of today.
Okay, so the next question is by Dr. Shaurya Tandon. Dr. Shaurya is asking about how can we strategize oral health for school children in India?
Okay. I would prefer the incremental mode for school children, sir. Actually, when you strategize for school children, let me give a small example of something which we did in Tamil Nadu, which may be an equal opportunity for everybody. We enumerated all the school children all over the state. We had close to 8 lakh children we had to see. And obviously, it will not be possible to see all those 8 lakh children and provide a school care. So we had one teacher in every school, which became an easier matter, who was dedicated nodal officer for this oral health program we initiated. And all those teachers in a particular district, they had one district school program officer who was dedicated for oral health care. We called those 36 teachers from those districts and educated them on oral health care and what we wanted to do. We planned out a screening of all the school children and providing pit and fissure sealants. This is not the oral health program which the government of India initiated. It was before that. So we provided pit and fissure sealants for all the school children who would need that. So we prioritized by training the trainers who are the district teachers, who then went to their districts, and all their schools were divided into the various zones under each CHC, and training was given them to assess only dental caries, for example. and we gave them the charts and the guidelines on how to assess caries and which of the caries children needed pit and fissure. Obviously, we could not leave the others halfway through, so we had to do some fillings and extractions too. But our priority was pit and fissure sealants. So if you can imagine, only for pit and fissure sealant for all the school children all over the state, we had to create this process, which cost almost 5.08 crores, which we outsourced from the National Health Mission. If you want a full care, you can probably divide the first year for dental caries, second year for periodontal disease, third year for malocclusion, and so on, and get the funding from the state health body to give incremental care in both in terms of from the classes as well as the treatment procedures for the diseases. Maybe if you can plan it out that way, we may be able to provide a very good care. Once the children were identified, the treatment was done in camp mode, with each PHC being the center, where they drafted the dental surgeons from in and around the PHC to provide that particular pit and fissure sealant to all the schools served by that PHC. This is how it works, sir. Maybe these questions are full-fledged questions for a full separate program by itself. And I would also like to inform, just a matter of curiosity, after 11, any other questions which come, we can always take them later as an email format, sir.
Okay.
Yes, sir. Yes, sir. So
Yeah.
we have one more question by Dr. Janaki Raman, sir. So your perspectives of envisioning public health dentists on par with other public health professionals and non-teaching jobs.
It is the widest opportunity available, sir. The teaching jobs are 315 into 3 into 4 into 5, and as per Dr. Saha's guidance, into 6 or 7, the best he can do for us. So that will be around 315 into 7 will be 2,200. Enough for all the people who are undergraduate students, even PG students even now, if our membership is taken, account is taken. And after that, what will you do, sir? So, we have to behave like a public health professional along with the general body, sir. We have always been trying to take dentistry separately, which I think has been our single most cause of, not going that forward as we should have. We should integrate with every public health professional we meet. There's nothing wrong in going and introducing yourself and telling him, that you are available. If there is some work which is overburdened with whatever may be the work, that you are skilled in public health and you would like to help. However small it is, that opportunity is all that matters, sir. Once you go and sit inside, it's like a camel's head. Then the tent is yours after some time if you are good enough.
Yes, sir. Sir, Dr. Ashwini has asked this question. As many interns and postgrad students are attending this presentation, where can we foresee public health dentistry and public health dentists in the next 10 years?
I would like to, I would be very glad, very happy to see one oral health officer for every CHC, sir. That's 1 lakh population, which would be a little too opportunistic, but I wouldn't mind in the initial stage, at least every district in the first process having one district oral health officer who happens to be a public health dentist. I think that vision, if we can take forward, that all the districts in our country have one post of oral health officer, which is manned by a public health dentist.
Okay, so the last question, sir, because as it's almost 11 o'clock, we have Dr.
Yes, sir.
Yes, sir. Yeah. Just last question, sir.
Yeah.
Dr. Saubhagya has asked this question. How can we improve CSR in oral health?
Sir, actually, this is something which is a good question. We'll just take 2 or 3 minutes time. These corporates are, I'm saying these corporates are not that way. They're very nice way. They have so much of funds, sir. They have so much of funds and they do not know how to use it. To be very honest with you, all that you need to do is to find out the various corporate offices in and around your place. Then go and visit their office, sir. Many a times we go and tell them what we want to do, sir. Please don't do that. You go to the HR man in that corporate office and tell him that you're a dental surgeon. That you would just want to give free oral health education to all his people at some point of time. That's free. You wouldn't want to charge money on that. It's part of your job, but you would like to have some pickup and drop and some minimal refreshments during that program, and that you will not refer them to any practice. If that is told to them in clear terms, he knows you have no personal agenda. Then the second thing is to make an arrangement with that man for a free oral health lecture. And once that is done, he will directly, the next step which I have usually seen, he shows his hand to the man who is in charge of CSR, sir. He will start by telling you, sir, we have 4 or 5 villages which we have adopted. We need some oral health care for them. Will it be possible for you to ask your friends to come and do something for us? And that is awesome, sir. We have 4 or 5 companies which we have used at government dental colleges to sponsor all our outreach programs. Doing very well. They spend good money. They don't waste money. You better do a good job, because they will cut you the minute they know you're not doing what you promised. But if you are doing what you are promised, the pickup and the drop, the food and refreshments for all the candidates, the yearly gifts for all the CRRIs who are working there, and a visit to their hospital, to their factories. If he is a tire company, all your car tires you get at reduced prices. If he is a fridge company, he'll give you at company prices. This is the I'm in a very low manner. But what I'm trying to tell you is, they are waiting for somebody who can do a sincere job for them. All that you need to do is to go and talk to a HR who you can convince that you are willing to improve the oral health of all the people working in his office, that he will not lose mandates because of oral diseases. It's a wonderful job opportunity. Thank you, Dr. Vamsi, again.
Thank you very much, sir. It's a wonderful interactive session. Due to time restraints, though the questions are pouring, anyone is there, you can email to secretary@iaphd@gmail.com, and we will get back to you with answers. I propose a vote of thanks on behalf of the Indian Association of Public Health Dentistry. Firstly, I would like to thank President Dr. Sabyasachi Saha sir, President Emeritus Dr. R.K. Bali sir, and the Vice Presidents and all the office bearers of the association, and all the members who are actively participating and attended this webinar through this particular platform. And there are many postgraduate students, interns and undergraduate students from across all colleges in India watched this webinar live. And sir, it was a very, the way you take it forward, the public health dentistry, and envision the people about how to, the role of the public health dentist in India, and how to take it forward in the country. It was amazing, and there is a lot of appreciation I see from the members. I will also thank all the institutions who have supported this event, and a special thanks to the platform providers for today, Dr. Vikrant Mohanty and his team, NRC from Maulana Azad Institute of Dental Sciences, and live streaming facilities are provided by Dr. Praveen and team from Anil Nirkunda Institute of Dental Sciences. And I thank each one of you for actively participating in. Long live IAPHD. Jai Hind. Thank you very much.
Thank you very much. Long live IAPHD. God bless.
Thank you, sir. Thank you, Dr. Vamsi.